I'm Jen Bovey. I'm a licensed clinical social worker. I am an EMDR certified therapist, and I'm an EMDR consultant. I specialize in EMDR therapy and AEDP therapy because these are the two modalities that I've witnessed clients be able to achieve actual healing from trauma. It's a lot different than just learning to live with the trauma or even just shoving the trauma in a tiny box in the back of your closet and going on with your life while it's still impacting you subconsciously. With EMDR, you're actually able to heal from your trauma, which is a game changer for many of us. EMDR stands for eye movement desensitization and reprocessing. And so basically what it does is the problem isn't, for many of us, that the trauma occurred. The trauma is what we make it mean about ourselves. And so through desensitization, which is a form of EMDR, we take the power away from that traumatic event. And when we process it, the trauma still occurred, but it no longer has any power over you. It no longer has any impact on your life. It's just something that happened back there. So it's a great modality for those who are truly wanting to heal. EMDR helps with a wide range of issues. So it can help with anxiety, depression, acute trauma, complex trauma, chronic pain, chronic illness, drug and alcohol addiction, anxiety, OCD, phobias, nightmares. It can really help a wide range of issues. So if there's something that's keeping you back from living your full life, consider EMDR. It's worth a shot. I love providing EMDR intensives because I truly am honored to witness the change and the healing that occurs in those blocks of time. So the difference between traditional psychotherapy, which is traditionally 53 minutes, is in an EMDR intensive, we're working together 4, 6, 8, 12 hours, and we're able to clear all of those targets that you knew were impacting you on some level, even if it was just a subconscious level. So you're able to achieve true healing in those EMDR intensives, which is just amazing. And it's such an honor to be able to witness those. I believe that EMDR intensives can be more effective than traditional weekly or even twice a week psychotherapy because I've witnessed the healing that happens in those blocks of time. And I know that my clients have also witnessed those changes and that healing that's occurred in those blocks of time. Oftentimes, when you're going to traditional psychotherapy, which is 53 minutes, it takes the first 15 minutes to remember that you even trust this person that you have a relationship with. It takes the next 10 minutes to get through the barriers and the defenses that you live with so that your trauma's not hanging out in the world. Then you might get 5 to 10 minutes of actual trauma work. And then you have another 10 minutes and you need to pack it all back up and make sure that you're presentable to go out into the world. It's challenging to make clinical traction in a 53-minute session. When a client comes in for an intensive with me, the first thing they'll notice is that I have a dog gate on my door and that my service dog will be with us. And he really struggles to not go up and regulate you, but we're really working on that so that he can understand that that's actually my job. When we meet for our pre-screening, we will identify some targets that you want to clear up, which are just some things that are holding you back in life, things that are struggle areas. Then we'll develop a target sequence plan, which will help us identify the negative and positive cognition, as well as just get to know each other a bit. We will probably work on, depending on how much time our intensive allows us, between 4 and 6 trauma targets. So we'll just be working through those things. I am very laid back and I'm a real person. So when you need to use the bathroom, you just get up and use the bathroom. I recommend clients bring drinks and snacks and a blanket if that's what makes you comfortable, a stuffed animal if that's what makes you feel safe. Whatever makes you feel safe and comfortable, bring it with you to the intensive because I want you to be as grounded and present as possible. With my intensives, clients typically see results almost immediately when we're using EMDR. I had one client that I don't even now remember what the target was we were working on, but the next week when she came in, she told me that she was now, for the first time in her life, able to stand up for herself, which was nowhere near what we were addressing, but it was just a byproduct. And she saw that pretty instantly, like the next day. I have another client who recently has noticed that they're able to sleep the whole night through. I have another client who has a significantly high level of dissociation who is able to be present more often. That's a huge shift for a lot of people. And they're noticing these changes the next day, the next couple of days, throughout that first week. What sets my EMDR intensives apart from other people's EMDR intensives? Well, first of all, I'm involved. Second of all, I'm a real person. So we address this like real people. I'm not going to put on any pretenses that I'm this perfect angel in the world. I'm a real human being who makes mistakes and screws stuff up all the time. So having said that, I may make some mistakes in your intensive. I'm going to acknowledge that as soon as I recognize it, and we're going to clean it up as best as possible. My intensives are a little bit different because I use a combination of AEDP, somatic therapy, parts work, IFS. I like to meet you exactly where you're at. So whichever modality is going to work best for you in that moment, that's the one that I'm going to use. I understand that EMDR intensives can be costly. Here's what I would encourage you to think about. How long have you been engaging in traditional psychotherapy, and is it actually working for you? I'm not knocking traditional psychotherapy. I still have a few traditional psychotherapy clients because that's what's most appropriate for them. But if you're not achieving your goals in the timeline and in the way that you want to achieve them, consider checking out an EMDR intensive. What have you got to lose? You may gain some healing. You may gain some ability to cope better. You may recognize that these things are no longer an issue for you, so you don't actually have to think about them or try to cope with them. I think everybody would benefit from an EMDR intensive. I've done trauma intensives. It's been very helpful for me. I think everybody would benefit from it. How do I ensure that my clients feel safe and supported through the EMDR intensive? I do lots of checking in. And not that obnoxious, do you feel safe? How are you doing? Are you okay? I just naturally, it's conversational for me. Is this safe enough for us to process? Does this feel safe enough to go after? Can you still feel me in the room with you? Do you want to keep going, or do you want to stop here? It's a lot of consent-based language for me because I want to make sure that I'm never pushing you. I don't have an agenda in an EMDR intensive. It's all your goals, your objectives, your things that you want to accomplish. So it's never about me. So I think that that's a really important concept. What do I find the most rewarding about guiding people through their EMDR intensive? Watching them heal, seeing the transformation from their perspective. For people who previously struggled with drinking, who now are able to abstain or drink socially, whatever that is for them. For people who had chronic nightmares and couldn't sleep, to be able to sleep. For people who were not able to be present ever, who are now able to be present in their daily life. And for people to be able to stand up for themselves. These are just some of the things that I've witnessed. It's just such a deep honor. And I really thrive on the change that they get out of it, that you get out of it. I don't know that you can know if you're a good fit for an EMDR intensive without me, without us at least touching base, which is why I offer free telehealth sessions so that we can get to know each other. So I can identify, are your goals even realistic for me to work with? And are we going to be a good clinical fit? Because if you can't trust me, if you don't like me, because not everybody does, we're not going to be a good fit. If you're interested in engaging in an EMDR intensive for whatever length of time, I would encourage you to go to our website, thementalwellnesscenter.com, go under the intensives link and look for EMDR, and just click a time to meet with me virtually so that we can just spend some time and get to know each other. Let's just chat and see if you're a good fit. Let's see if your goals are appropriate for an intensive or not. I hope that clients take away from their work with me in EMDR intensives that not only can they heal, but they are healing. And I hope that they are able to identify some of their own inner resilience, for lack of better descriptors, that they've survived some really horrible events or activities. And I want them to be able to witness and recognize that that's not going to stop them anymore.